I practice here in Rockville Center at the Pain Management Center of Long Island. In this practice, we've been really able to bring a lot of new techniques to our patients and to the community. One of them specifically is this new mild procedure, and we're really excited about it. The mild procedure is a great procedure. It affords us the ability to decompress the spine, provide relief on an ambulatory basis where the patients go home. We see the relief very early after the procedure, and the other favorable part is the procedure does not preclude a patient from having surgery or other interventional techniques should they need it in the future. During the procedure, the patient is brought into the procedure room or operating room, laid on their stomach in the prone position, and there's a full prep and drape like surgery. At that time, we use fluoroscopy, which is a special type of x-ray that shows up on a television type screen, and we can see the spine, and then we do what's called an epiduralgram. An epiduralgram is where we inject contrast or dye into the epidural space to define the space and show the areas of thickened ligament or stenosis. From those, we use some special views with the fluoroscopy, the x-ray machine. We go ahead with the procedure and we're able to place what's called a trocar, which is an introducer type device that's about the size of a hole punch, or 5.1 millimeters, and we're able to do that percutaneously. We may make a small, tiny incision, or we may just introduce it directly through the skin like a needle down to the levels which we work. Through that device, we will remove some bone often with what's called a rongeur. It's a device where we can remove pieces of bone to open the space so that we can get access to the ligament. After we accomplish that, we place the tissue sculptor, which is another specialized device where we can remove pieces of the ligament. With repeated small bites of tissue, we're able to debulk and relieve pressure that the ligament's causing in the spinal space. During this, we repeatedly shoot epiduralgrams to show the areas where we're working and evaluate the effectiveness and if the space is open. Once we're happy with the results, where we see improved flow on the epiduralgram, we will remove all the devices, place pressure on the skin for a few minutes, and place even just a Band-Aid as a closure. The patient often does not need any sutures or anything like that, and the patient will go to recovery and go home that day. The patients often experience great relief the day of the procedure. Even upon discharge from the hospital, they're beginning to notice their improvement. We've done quite a few of these, and we're having great success with them. Patients are describing excellent relief, and those that have maybe not had excellent relief have shown to have improved relief from other techniques that we've done, like epidural steroid injection.